should people monitor themselves for symptoms? So the situation where we are recommending that people should monitor themselves for symptoms is if you are a person who could potentially have been exposed to the virus. And the type of situation this would be is if you travel to a country where the virus is circulating, or if you've potentially been in contact with somebody who is infected with the virus, or if perhaps you're a healthcare worker and you've been treating patients with the virus, you will be asked to self-monitor yourself for 14 days. What does self-monitoring involve? It's really watching out and paying attention to your body's own signs to see if you are feeling unwell at all. And the most important signs and symptoms of this virus are fever. So fever, if possible, you should measure your temperature with a thermometer. But if you don't have access to a thermometer, you can look for signs of feverishness, which is feeling hot and cold and sometimes shivering. And in other people, when they touch your body, it may feel hot, and that could be a worrying sign. And then the virus is mainly a virus of the respiratory tract. So symptoms like coughing or shortness of breath or sore throat or any respiratory symptoms could also be worrying signs of the virus. And if you do have any of those worrying signs and symptoms, and you are a person who could be at risk of having the infection, then that's really the time to seek care and be evaluated by a healthcare provider who can decide if you need to be tested.
If you develop symptoms of respiratory illness, including a cough, fever, and shortness of breath, you must seek medical care early. It's important to call your doctor first, self-isolate, and advise on your travel and contact history. If you would like to know more on anything relating to COVID-19, call the General Public Hotline at the National Institute of Communicable Diseases on 0800 029 999, as well as 0800 111 132, or log on to www.nicd.ac.za.